Good day, I am Miss Maysaba Abatario, and today I will be performing our turn demonstration for the shampooing the hair of the client confined to bed. So for today, what I will be doing is to place my device on a position where you can clearly see the procedures that we will be doing. So to start, um, for the preparation, what we will need to do is to assess whether to assess and determine the routinely used shampoo products of the client. This is us this is for us to prevent any allergies and any allergy reactions and maintain consistency with the client's preferences. So, ma'am, may I ask and may I know what kind of shampoo products do you use?
Um, any um the brand na lang. The brand that I use is actually Cream Silk.
Oh, cream silk. Okay, so that is a good choice, ma'am. Okay, so now we can proceed with assessing the any scalp problems of the client. So, ma'am, may I know, do you have or have you had any experiences with scalp problems?
No.
No. Okay, so that is good to know, ma'am. And also, may I just ask permission to oh no, to part your hair.
Yes.
Okay, so I will just be inspecting your scalp also. This is for us to ensure that you don't really have any scalp problems. So can you turn your head to your left, please? Okay, thank you so much. Okay, so parting her hair to check for her scalp. So, Okay, so ma'am, thank you so much for your cooperation. And as the client have said, upon observation, I have not seen any scalp problems for the client. So, um, excuse us for a moment, ma'am. Would you like me to get your phone?
Yes.
Okay. So, now we can proceed with assessing the activity tolerance of the client. So, ma'am, for your activity tolerance, do you can you still tolerate to move your head and also your shoulders? Okay, so that's good to know. And now we can proceed with assembling the equipments and supplies. But first, we have assessed those three things for us to detect any conditions like infections, sores, or lice early and avoid exacerbating them. And also, we have assessed those things to ensure that the client can handle the physical strain or of the procedure without any fatigue and discomfort. So now we can proceed with assembling the equipment and supplies. What we will need is a comb and a brush, a plastic sheet or pad, which is right here on the bottom part of the bed or at the top of the client's head. And also, we will need two bath towels, shampoo basin, washcloth or pad, and bath blanket. Also, a receptacle for the shampoo water and pitcher of water, bath thermometer, liquid cream or shampoo, and lastly is our um, hair dryer, which is in here. So, now we can proceed with determining whether a primary care provider's order is needed before a shampoo can be given. And also, we also need to determine the type of shampoo to be used and to determine the best time of the day for shampoo. So earlier I have already asked the client what type of shampoo she used, and lastly, in determining the best time of the day for shampoo, this is for us to add this is for us to assess and determine when some patients with specific medical conditions like head injuries or post surgery may need medical clearance before hair washing. So, after clearing all that, we can now proceed with the procedure. So, firstly, we have to explain to the client what we are going to do, why this is necessary, and also how she can cooperate. So, ma'am, what we will be doing today is to wash and shampoo your hair, okay, ma'am? And this is needed to be done for us to ensure the cleanliness of your hair and your head. And this is also to provide you comfort and to ensure that you don't have any infestations or infections in your head. So what you can do there is just lie down there comfortably and just do the things that I will be needing you to do, such as raising your heads and your shoulders. Okay, ma'am?
Yes.
Okay, so thank you so much for your cooperation, ma'am. This is um this is needed, or this procedure is needed for us to promote cooperation, reduce the client's anxiety, and obtain her informed consent. So now we can proceed with washing our hands and observing other appropriate infection control procedure. So, assuming that I have washed my hands already, and for the other appropriate infection control procedure, I have here is my gloves. This is for us to avoid any cross contaminations, or and also to provide for the client's safety and my own. And also we can use alcohols, face masks, PPE, and hair caps, and many more. Those are just some of the examples. This is important to prevent the spreads of infections, as I have said, between the nurse, which is me, and the client. So, nextly is to provide our client their privacy. So, in providing the client privacy, what we will need to do is to close the curtains, the doors, and also to give the client her blanket. And um, this is for her um, modesty, dignity, and to provide comfort. So now, in giving that privacy, this is important for us to observe respect for the clients, as I have said, dignity, and also the her trust. So now we can proceed with the position and prepare the client appropriately. So, in positioning and preparing the client appropriately, what we will need is to assist the client to the side of the bed from which I will be working on. This is to prevent any ay, this is wala ng kuryente. So, excuse us for that. Um, Now we can proceed with the assisting the client to the side of the bed, as I have said, from which I will be working on. And this will be preventing water from soaking the bed, and to maintain the client's comfort. Also, we have to remove pins and ribbons from the hair of the client. This is important for that to not be interrupt to not for us to not be interrupted in doing the shampooing the hair of the client. So also what we will need to do is to brush and comb it to remove any tangles. So firstly, I will be using my my fingertips to untangle if the client's hair indeed has any tangles. And nextly is I will be brushing her hair to untangle any more tangled hair, starting from the lower section of her hair and moving to the upper part once we are done. So here. Can you please turn to your left, ma'am? Okay, so for this section. Okay, turn to your right, please, ma'am. Okay, thank you so much for your cooperation. So, after combing the client's hair, now we can proceed with arranging the equipment. So, earlier, what we just did is for us to prevent, as I have said earlier, is to prevent any soaking of the bed. And now, in arranging the equipment, we have to put on the plastic sheet, which is right here, which I have done earlier, and plastic sheet or pad on the bed under her head, and also to remove the pillow under the client's head and place it under her shoulders, unless there is some underlying conditions that we cannot proceed with putting the pillow under her shoulders. But as for the client, ma'am, may I know, would you be comfortable with me putting this pillow under your shoulders? Okay, so with the client's consent, now we can proceed with putting the pillow under the client's shoulders. So, ma'am, I will just be assisting your shoulder. Okay, so please now there. Okay, so thank you so much for your cooperation, ma'am. So now that we are done with putting the pillow under the client's shoulder, now we can proceed with tucking a bath towel around the client's shoulders. So now we can put this towel. Okay, so um, ma'am, can you please just move towards the end of the bed? Okay. Ayan, okay. So let me just read that one more. Okay. So thank you so much for your cooperation, ma'am. So now what we will be doing is tucking a bath towel around the client's shoulders. So again, ma'am. Okay. Let me do this here. Okay, so tucking them on her shoulders. Okay, thank you so much, ma'am. And then After tucking the bath towel around the client's shoulders, we can now proceed with placing the shampoo basin under the head, which is right over there. And now we can proceed with unfolding the top bedding down to the client's waist and cover the upper part of the client with the bath blanket. So, ma'am, let me just move your hand over here and then fan fold this top blanket over to the waist. Okay. So after fan folding the top blanket to the waist, we can now proceed with putting a bath towel, um, putting a bath blanket on the upper part of the client. Here. Okay, let me just put it. So, okay, thank you so much, ma'am. So, as you can see, there is the fan folded, where's that? The fan folded top blanket and a bath blanket on the upper part of the client. So, um, now we can proceed with um, placing the receiving receptacle on a table or chair at the bedside and put the spout of the shampoo basin over the receptacle. So, I have already done that. So, now we can proceed with protecting the client's eye, and in which we will be placing a damp washcloth over the client's eye. This is for us to prevent any this is for us to prevent any shampoo or water irritations that might get into the client's eyes. Okay, so ma'am, I will just be putting this damp washcloth. Would you be okay with that, ma'am? Okay. Thank you so much. So there. So after that, we also have to put a bath blanket on the client's um, shoulder even more. This is for us to prevent soaking the bed. Can you move a little? Like, faster. More. More. Ayan, thank you. Too much na pala. Okay. So, thank you for your cooperation, ma'am. So now that we have ensured that the client that the water will flow down to the linen or the receptacle for the shampoo water, now we can proceed with shampooing the hair, which in where we will be wetting the hair thoroughly with the water, and then next is to apply the shampoo to the scalp and make a good lather with the shampoo while massaging the scalp with the pads of our fingertips. So firstly, we will be rinsing her hair. Okay. Okay. So just so sorry. Um, so sorry, ma'am, for that. Okay, so let let me just divide her hair into sections as her hair is a little thick. Okay, so um, now that we are done with rinsing the client's hair, now we can proceed with the shampoo. So, in shampooing the client's hair, um, I'll just be putting the shampoo in my gloves. So, ma'am, what I will be doing here is to shampoo your hair thoroughly on your scalp, and I'll do a little massage here, okay, ma'am? Okay. Okay. So moving on here. Okay, so now that we are done with shampooing the client's hair and also while massaging the scalp, now we can rinse the hair briefly and apply shampoo again. So ma'am, I will be rinsing your hair now. Okay, so applying the shampoo again. Turn your head to your left, please, ma'am. Left. Okay. Sorry. Okay. To your right. Okay, that's good now. Okay, so now we can again proceed with rinsing the hair of the client. Okay, so now that we have rinsed the client's hair thoroughly, so now we can squeeze much water as we can, as much as possible. Okay, squeezing them just like this. Let me just know if you're experiencing any discomfort, okay, ma'am? So now we can dry our client's hair thoroughly, and we can rub the client's hair with a heavy towel, and we can also dry the hair with a hair dryer and set the temperature at warm, and then continually just move the dryer to prevent burning the client's scalp. So in doing that, let me just okay. So As for the heavy towel, I will be using this one and just dry the client's hair. So I will just be removing this one now. Placing that in a linen hamper. Okay, so now that we are done with drying the hair with a damp towel, with a heavy towel, now we can proceed with using a hair dryer to blow dry our client's hair. So in blow drying the client's hair, we have to ensure that we don't just go over to a one spot or the same spot for a very long time and move over to several parts of the head or the hair of the client. This is for us to prevent any more damage to the hair or the head of the client, such as balding, spotting, or hair loss and pain from the heat of the dryer. So, assuming that this is turned on, we are now be proceeding with blow drying her hair like this. Starting up there, so like that. Okay. So now um, we can proceed with ensuring the client comfort and assisting the person confined to bed or our client to a comfortable position. And we also have to arrange the hair using a clean brush and comb. This is for us to prevent any tangling and matting, to promote self esteem, and ensure that the client's needs or the client feels clean and presentable. So I will just be removing this washcloth or damp cloth and proceed with combing and untangling the lower part of the hair. So I'll be hair brushing the lower part of the hair first. Okay, so um, once that we are done with combing the client's hair, and as we can observe, there are no more any tangles on her hair. Now we can proceed with documenting the shampoo and any assessment that was done for today. This is to ensure that the continuity of care provide of continuity of care and provide information for further nursing care and physicians reviews. Okay, so now that we are done with all of that and the last part, which is the documentation, now we can end the return demonstration. Thank you so much.